Hi, my name is Adam Janjua and I'm a GP in Lancashire. Welcome to what is now the second in a series of videos that aims to raise patient and public awareness on the commonly occurring signs and symptoms of cancer that we see here in the United Kingdom. If you haven't already seen my first video, which deals with how you can reduce your cancer risk in your lifetime and some of the early non-specific symptoms of undiagnosed cancer, I would urge you to give it a watch and to share it amongst your friends and family. It's available on the YouTube channel Health Awareness. The cancer that I'm going to talk to you about today has been subject to quite a lot of media attention over the past couple of months. I only need to mention the names Stephen Fry and Bill Turnbull for most of you to know what cancer I'm speaking about. Today I'm going to be talking about prostate cancer. Whilst prostate cancer has been around for quite some time, the number of men that are being diagnosed with it is increasing year on year. It's important that the public become aware of the signs and symptoms to look out for so that they can come and seek help. I'm going to mention a bit about what happens if you were to go and see your GP. I'm going to talk a little bit about the prostate and what other symptoms you could present with if you were suffering from prostate cancer. So before we go on and talk a bit about prostate cancer and the various signs and symptoms you need to look out for, let's talk a bit about the prostate gland itself. The prostate gland is situated at the base of the bladder, just in front of the rectum. It's usually the size of a walnut, it's only present in males, and the only function that it has is to secrete a fluid that nourishes and protects the sperm. The prostate in most men tend to grow with age. So the prostate enlarges the older you are. The tube that takes urine from the bladder to the outside is called the urethra. It tunnels through the center of the prostate to get to the penis. So when the prostate enlarges, the first symptoms that are usually experienced are those that deal with the urinary system and the urine flow. So let's give you some facts and figures about prostate cancer. In the United Kingdom, prostate cancer is the second most commonly occurring cancer overall. But in males, it is now the most commonly occurring cancer. 1 in 8 males can expect to develop prostate cancer over their lifetime. If you're African or of Afro-Caribbean descent, that risk increases to 1 in 4 over your lifetime. Every year, 47,000 people are diagnosed with prostate cancer in the United Kingdom. That amounts to almost 1 patient every 11 minutes. Every 45 minutes, somebody in the United Kingdom dies as a result of prostate cancer. That amounts to 11,000 patients per year. But there is some good news. Over 330,000 patients are now living in the United Kingdom after having received treatment for prostate cancer. But the figures speak for themselves. They do tell us that we need to do more in the fight against prostate cancer. There are the obvious ones, which are the lifestyle factors which I discussed in my first video, which is still available on YouTube. These are being of a normal weight, not smoking, drinking alcohol within the suggested limits, and doing regular exercise, as well as having a good diet. You're 2.5 times more likely to develop prostate cancer if a first-degree relative such as your father or your brother has had prostate cancer. This risk is further increased if your father or your brother developed prostate cancer before the age of 60. The risk is also multiplied if you have had more than one first-degree relative who have had prostate cancer. In cases where your mother or your sister may have had breast cancer, and if this breast cancer was attributable to a faulty gene known as a BRCA1 gene or a BRCA2 gene, your risk factor for developing prostate cancer is also increased. This is particularly true if your mother or sister were under the age of 60 when they were diagnosed with this breast cancer. If you recall earlier on when I mentioned the position of the prostate, which was at the base of the bladder, I also mentioned that the urine tube that leads out from the bladder passes through and tunnels through the prostate from its top to its bottom so that it can get to the penis. I also mentioned that the prostate in most men tend to grow with age. So the prostate enlarges the older you are. Therefore, most of the symptoms that people present with, whether it be because of prostate cancer or because of prostate enlargement, will be related to urinary symptoms. Some of the symptoms that may point towards having prostate cancer are an increasing urge to go to the toilet during the day with an increased frequency, having an urgency to pass urine, needing to rush to the toilet, having to wake up in the middle of the night to go to the toilet to empty your bladder, sensation of incompletely having emptied your bladder, as in you've just been to the toilet and feeling the need to go back to the toilet to empty your bladder again, having a poor stream where you don't feel that the stream is as strong as it used to be, straining to pass urine, dribbling after having completed urination, having hesitancy where you're finding it difficult to initiate a stream and starting to wee, having some blood in your urine, having some blood in your semen, erectile dysfunction, although this is rare for it to be associated with prostate cancer. Lastly, I feel it's prudent just to mention that some people with quite aggressive and advanced prostate cancer that they haven't been diagnosed with yet may actually present with bone pain, which may be a sign that the cancer is spread to the bones. But this happens very rarely, but can be one of the rare presentations of prostate cancer for the first time. It's important to realize that in some cases prostate cancer presents with absolutely no symptoms at all. And on the flip side, you may have had one or several of these symptoms that we have mentioned prior, but they may not be related to prostate cancer at all either. There's a condition known as benign prostatic hyperplasia, or BPH. This is basically a fancy name for the prostate having grown with age and is now pushing on the urine tube and causing some of the symptoms that we have mentioned, such as hesitancy, having a poor stream, and dribbling. This is a completely normal, non-cancerous condition and is very treatable with medications to try and shrink your prostate. But it's very difficult to tell these symptoms apart and know whether it's caused by prostate cancer or by some other reason, which is why it's important to discuss with your GP if you have had any of these symptoms. When a patient presents to me worried about prostate cancer, I don't just use their history to decide whether they have prostate cancer or not. There's a triad of things that we use to try and see whether a person actually has prostate cancer or whether they need further investigations. So one of them is history. I will speak to the patient, assess their risk, talk to them perhaps and see if they have any other risk factors such as having brothers or sisters with breast cancer or prostate cancer, look at their lifestyle, and then make a decision based on that. That's just one part of what we do as GPs. The other thing that we do is a rectal exam. The patient is made to lie on his left side with his back towards the doctor. A finger is then inserted into the rectum to feel or assess the state of the prostate that lies directly in front of the rectum. The prostate is normally felt as a smooth structure without any irregular lumps on its surface. It should feel firm but not hard. If any hard lumps or irregularities are felt, this may be an indication that something sinister is going on in the prostate. Sometimes we feel an enlarged prostate, but nothing to suggest that there is anything cancerous there. This prostate exam forms a second part of how we decide whether somebody may or may not have prostate cancer. The third part is a test. You will all have heard about the PSA test. There's a lot of controversy about whether you should have one or not. I've heard a lot of patients come and tell me when I speak to them as the cancer lead for my local CCG that somehow their GPs seem to be against giving them a PSA test. Nobody's against you having the PSA test. But as GPs, we are very acutely aware that you may not have the full facts behind what the PSA test is and its limitations. And the problem with that is that if you just end up having a PSA test when you come in for your yearly bloods, and it turns out to be normal, you will go away feeling fully reassured that you don't have prostate cancer. That is not the case. A normal PSA test does not mean that you do not have prostate cancer. I'm going to be talking in detail about PSA and its pros and cons. But it's really important to realize that your GP is your friend when it comes to dealing with symptoms and signs that could perhaps be prostate cancer. So the sooner you attend and see your GP and discuss it with them, the sooner you can either be given the all clear or further reassurance, or given advice on how you can reduce your risks, or even be referred for further investigations.